guys, welcome to CRPS and Rheumatoid Diaries. Welcome back if you've been here before. I haven't been on for quite a while because it's just been, I wasn't doing really well and there wasn't a whole lot more to say. So where I'm at now is I'm at the 6-week mark yesterday, which was April 8th, with my bilateral foot surgeries. I can fully bear weight on the foot now that I had the fusion redone. As of yesterday, I kind of realized I could do that. I haven't had my 6-week follow-up yet, which is Friday, so I'll probably get the go-ahead then. And I'm hoping that's a good sign, because the last time I had the fusion done, the pain never went away. This time the joint pain is gone. Like, there's no surgical pain left other than, the incision's a bit tender yet still. And I have the CRPS still, but the surgical part, the joint part, the pain is gone. So I'm hoping that means my foot's beginning to fuse. And as far as my other foot, I was able to walk on that probably a couple weeks after surgery. But the incision, the top part of my foot's still tender, but I can walk on it. And where I got the partial toenail removal, that has been brutal. Like, I'm 6 weeks past that and I can't get it healed. And I'm trying everything. So if anyone has any suggestions for me, leave them in the comments below, please, because I've been soaking it in Epsom salts twice a day, every day. I added lavender, hearing that could be good for it. I've tried peroxide, I've tried antibiotic cream. And also, because of the kidney infection I had, I was on some heavy-duty antibiotics. And that toe is just not wanting to heal. So I'll probably have to deal with that when I see the surgeon on Friday and just figure out what the heck to do. As far as the CRPS pain, yeah, it's still there. And today, for the first time in, I don't know, at least a couple of weeks, if not more, I'm going without the cream that I put on, the compounded cream, the lidocaine mixture, the mixture with lidocaine and GABA and ketamine. I'm going without it today just to get an idea of how I'm doing with the slipper on and bearing weight on it. And then tomorrow I'll use it again and see if there's a difference. The pain is up and down, so it's ever changing. So it's really hard to know how I'm doing, So yeah, that's still there though, unfortunately. Anyway, I've got like a couple of video clips I'm gonna post, so I'm gonna keep this part short, and then probably give another update after I've had my 6-week follow-up on Friday, which is the 12th of April this month. I'm gonna guess ahead of time that he's gonna say I can walk on it now. It's probably still too soon to tell if it's fusing, but maybe it'll show a little bit anyway. Even if it shows that it's starting to, would be great at this point. But if it's too soon, I understand still. And then see if I can get some answers about my toe and whatnot. The toenail part that just doesn't want to heal. Like, it healed bent from my fusion surgery, which is what's causing the problem. And I don't really want to go through another surgery to fix the bent. So we'll see what he says. Anyway, I'm going to keep short, add the clips. One of them's just kind of a really short one from my 2-week follow-up. You don't really see much. And then a couple others I'll just add in. And let me know in the comments below how you're doing. If you had toe fusion, if you have CRPS, if you have rheumatoid. Oh yeah, rheumatoid's bothering me again. Now that I'm healing from the surgery pain, I can feel the rheumatoid pain more too. But anyway, let me know in the comments how you're doing, how you cope in the bad days, even on the good days. And there's hope, and hope is a good thing. See you in the next one. My follow-up visit 2 weeks after my bilateral foot surgery. Just waiting to see the doctor. I still have my socks on because of the CRPS. My foot looked cold. It is cold already, and that causes a lot of pain. So anyway, I don't know how long I'll be waiting. 6 weeks out from surgery, and I'm still having to soak my toe where the partial ingrown toenail was removed. It's not healing. It's getting frustrating having to soak it twice a day, every day, just trying to get it healed. I've tried everything: antibiotic cream, peroxide, lavender, Epsom salts, you name it. It's not healing. My other foot has been healing, the one that had the fusion redo, but this toe does not want to get better. And the scar you see there, that's from having a fusion and then having recently, like 6 weeks ago as well, having the hardware removed. That I can walk on. The top of it here is painful still to touch, but I can walk on it, and I've been able to walk on it, you know, even after 2 weeks after I had the hardware removed. So that's where we are with that. Started walking full weight yesterday, April 8th, 24. Still have the CRPS pain, but the joint pain is gone. Finally, the last time I had the fusion surgery done, the joint pain never went away. So that's hopeful for me. I have my 6-week follow-up. Yesterday was 6 weeks, April 8th. But I have my 6-week follow-up this coming Friday, which today's Tuesday. So what date is that? I'm just heading to the calendar. The date is the 12th of April. So yeah, the joint pain is gone. So I'm hopeful this time it's fusing. I still have the CRPS pain, hence the bunny slipper. But yeah, this is hopeful.